Head injury is any type of injury that happens to the scalp, skull, or brain. The main reasons why head injury would happen is because of motor vehicle accident, falls, and assault. The main sign and symptom you're going to see with a head injury is going to be a decrease in the level of consciousness. This happens because of the increase in intracranial pressure that's going on after the head injury. Increased intracranial pressure can cause headaches, nausea, vomiting, eye issues, and motor issues, as well as seizures. To have a better understanding of intracranial pressure, refer to the video on increased intracranial pressure. The last symptoms we want to look at is subjective data. Make sure you ask someone else, not the patient, about how the head injury happened. Because of the decrease in level of consciousness, the patient may not be a reliable source of data. There's a lot of different things that can happen because of a head injury. I'm going to start with something called a scalp injury, and this can be three things. The first is an abrasion, and this is when the top layer of the skin is removed. The next is a contusion, and this is when the skin is still intact, but a hematoma forms. A hematoma is a collection of blood. And then a laceration can also happen, and this is when the scalp is torn. These are generally not life-threatening, but they still require medical attention. Another thing that can happen because of a head injury is a skull fracture. There's different types of skull fractures. The first one I want to talk about is called a linear fracture, and this is when there's a crack in the bone. This looks like a really thin line across the skull. Next is the comminuted fracture, and this is when the bone shatters into pieces. There's also something called a depressed fracture, and this is when the bone fragments are going inward towards the brain. The last and most important skull fracture is called a basilar skull fracture, and this is when there's a linear fracture at the base of the skull. The signs and symptoms of this fracture develop over several hours, and the symptoms include something called battle sign, which is mastoid ecchymosis. This means there's bruising behind the ear, or something called raccoon eyes. This means there's periorbital ecchymosis, or bruising around the eyes. There can also be CSF leak, or cerebrospinal fluid, and this can be coming out from the ears or nose. How you can detect CSF is through two tests. If there's no blood, you want to use a glucose test because CSF has glucose. If there is blood, then you want to do the halo test. The halo test involves getting a gauze, collecting some of the CSF, and seeing if the blood coagulates to the middle, leaving a yellowish ring around it. This is why it's called the halo test. Generally, the interventions for this is just watchful waiting, seeing if the condition of the patient gets worse. You can also collect the CSF with loose dressings, and make sure you do not insert an NG tube, as this is contraindicated because it can go straight into the brain because the base of the skull is fractured. The medical intervention for this is going to be surgery, and this is if there's complications such as bleeding, cranial nerve damage, or CSF leak. A rare but serious complication that can happen with a basilar skull fracture is meningitis. If there is a CSF leak, there's a chance that the patient can get meningitis. Make sure you monitor temperatures and know that anything above 100.4 is considered a fever. Alright, now we're going to talk about different types of brain injury, and the first one I want to talk about is something called a concussion. A concussion is a diffuse injury, meaning it's pretty generalized in the brain. It leads to altered mental status, and it may come with or without loss of consciousness, so the patient may pass out or they may not. This type of brain injury is very mild, and the patient usually goes home with a reliable adult. You also want to teach them to wake them up every 2 hours and assess for any symptoms of increased intracranial pressure, like a headache that's not relieved with pain medicines, or increased nausea, vomiting, or decreased level of consciousness, such as restlessness, confusion, and lethargy. The person at risk for concussion is anyone that does contact sports, like football. If this is a repeated injury, then there can be short-term memory loss. Another form of brain injury is called a contusion, and a contusion is a small and specific area where there can be bruising or bleeding. Something that can happen with a contusion is something called coup contre coup, and this is when there's damage to the opposite side of the impact. So if the impact is in the front of the head, there's also going to be damage in the back of the head. Another severe type of brain injury is called diffuse axonal injury, and this is such a severe head injury that the part of the nerve cells inside the brain, the axon, tears. There's a very poor prognosis with this type of brain injury. The next thing I want to talk about is something called a hematoma. A hematoma is going to be a collection of blood. The first type of hematoma I want to talk about is called epidural hematoma, and this is an emergency. There's bleeding occurring between the dura mater and the skull. The patient has a rapid decline because this is arterial bleeding. Typically, this is because there's a tear in the middle meningeal artery. The classic signs and symptoms for epidural hematoma is going to be initial loss of consciousness, followed by a lucid period where the patient can wake up and be alert, followed by a decline in consciousness again. This is an emergency, and it's very important we get the patient to get a craniotomy. This is a surgical procedure that involves opening up the skull to remove the hematoma that's there. The next type of hematoma is called a subdural hematoma, and this is when there's a bleed between the dura mater and the arachnoid mater. This is because there's a tear in the bridging veins. Because the tear is in a vein and not an artery, the bleed is a lot slower, and so are the symptoms. So the decline is actually slow and progressive and can take hours to days for the symptoms to appear. The treatment for this is going to be a craniotomy. Next, I want to talk about something called subarachnoid hemorrhage. This is when there's bleeding below the subarachnoid membrane inside the subarachnoid space, not necessarily within the brain tissue. The reason for this type of bleed is usually an aneurysm rupturing. An aneurysm is a weak wall of the artery that can easily break. When this happens, the patient usually experiences the worst headache of their life. This is how they describe it. The treatment for this is also surgery, specifically clip and coil. Clipping an aneurysm is exactly how it sounds like. There's a clip that clips in the aneurysm, preventing from bleeding. Coiling is when they insert a coil into the aneurysm to prevent it from bleeding. The last type of bleed I want to talk about is intracerebral hemorrhage, and this is when there's bleeding into the brain tissue. The patients have a very poor prognosis with this. The main diagnostics used after a head injury is primarily going to be CT scan, but MRIs, lumbar punctures, and cerebral angiography can also be used. The main nursing interventions for head injury is really all surrounded around preventing intracranial pressure. So if you haven't seen the intracranial pressure video, then I would highly suggest it so you know what type of interventions this involves. Aside from providing oxygen, usually with a non-rebreather if it's an emergency, the patient may also be intubated. We also want to initiate seizure precautions, so make sure you pad the side rails and have suction at the bedside. Alright guys, that's everything you need for head injury.